The McMurray Enhanced Airway is an easy-to-use tool that is designed to offer a more comfortable experience for you and your patient. The MEA effectively stents open the redundant tissue in the pharynx to maintain an open airway. This video covers 1. Indications for MEA use, and 2. Step-by-step use instructions. The MEA indications for use include 1. During deep sedation or hypoventilation, use the MEA to open and maintain a patent airway. 2. During apnea, use the MEA to help facilitate positive pressure intraoral ventilation. Attach the MEA and MEA connector to the anesthesia circuit or manual resuscitator. Cup a patient's chin in your left palm. Manually close the patient's mouth and nares by encircling the MEA connector. Use thumb and index finger to pinch the nares closed while pulling the cheeks and lips together. Instructions for use. 1. Assess integrity of packaging and check expiration date prior to opening package. 2. Select appropriate MEA size. When appropriately sized, the MEA's distal tip will sit slightly above the epiglottis. To accomplish this, the MEA should measure approximately the distance between the philtrum and the tip of the earlobe. Sizing matters to avoid laryngospasm, gastric distension, apnea, and other potential complications listed in the instructions for use. 3. Prepare for MEA placement and assess patient readiness. The MEA can be placed in any patient position once the patient is unresponsive to verbal stimuli and a chin lift, and has an absent intact gag and/or cough reflex. 4. Place the MEA. With the curved end facing the hard palate, pull the chin down and gently guide the MEA straight back over the tongue until a patent airway has been established. No lubricant or tongue depressor is needed. The MEA bite block can be placed between the molars. The flange should sit outside the lips but does not need to be flush with the lips, allowing for fine-tuning of depth. 5. Confirm placement. Confirm appropriate sizing and placement by observing rise and fall of the chest and monitoring EtCO2 waveform and oxygen saturation. If unable to maintain oxygen saturation, resort to other airway options. 6. Remove the MEA only after the patient's bite has been released on the MEA. For potential complications and best practices, please refer to Instructions for Use insert located in each MEA box or at mcmurraymed.com. Thank you for your interest in the MEA. This training video is to be used as a resource to build upon previous proper airway training. We are glad you share our desire to improve patient care, safety, and outcomes.